government is doing nothing but waiting for the foreigners to tell them, hey, we have a cure. Do you want it? Yes. Then come take it. Their own institutions are doing nothing.
All right.
The president gave an address. And never said, we are giving out so amounts of naira, so amounts of dollars to institutions.
But to correct you there, the government had actually given out certain millions of naira to researchers to research for a cure of the virus in Nigeria. And that is where Professor Iwu's vaccine or cure or treatment came out from.
It came from the money the federal government gave us.
It came out because the federal government had said they were going to,
And there is an incentive for any doctor.
Yeah, incentive. That's right. What I was looking for.
Incentive. You're speaking on air.
Listen to what I'm saying. This is the problem.
Listen to you. I want you to listen. You said Prophecy Woods came out. Iwu's research came out as a result of the money the federal government is giving.
Could you listen to me? I said it came out.
Okay, I will listen to you.
It came out when the incentives were given by the federal government. He and so many other professors. When the incentives were given out by I think about 30 million, or was it 30 or 50 million? I can't remember now. When incentives were given by the federal government, it says anybody who has a treatment or who can provide a treatment or a cure for this will get so and so. That's what I'm saying.
Okay, you're saying the federal government said if somebody provides a treatment, he will get so amount of money. So what I'm saying is the federal government, that is a different thing. If you have about grant, give you money. What I'm saying is the federal government have not given money to their scientists, to their institutions to get this thing. They're not being proactive. They are being passive right now. So, and that is a deficiency of leadership.
All right.
We expect the federal government, like I was expecting things like we have equipped some hospitals, 3-4 with ventilators. We have gotten face masks. We have distributed about 10,000 face masks to Ogun State, 10,000 face masks to Enugu State. I didn't get that from the speech yesterday. And it was almost very, very, very empty.
All right, then.
For me now, I feel a little bit scared. Because I think that the government who is supposed to protect me, who is supposed to give me something,
thank you very much.
Is giving nothing.
We got to go, Kennedy, now. We got to go. Thank you very much for your conversation there. But that's too much we can take. The people in the studio are very angry. They don't want to say last words because, I mean, even the people that they are fighting on their behalf does not want to learn any lesson. But that's the much we can take on today's household. Has been Wealth Wilson, Bolu Ajayi, and yours truly, Kalada, in the studio. Let's do this again tomorrow. But up until then, stay tuned for the news update. And after that, today's Sports Live. Good afternoon to you.
Every day, every hour, when the big stories break, depend on our 24-hour news team to bring you the latest. Today, 95.1 FM.
Today, 95.1 FM. Port Harcourt. News update.
Good afternoon, and here is the news update on Today 95.1 FM. I am Wealth Wilson. This report says the Lagos State government has discharged 5 coronavirus patients at the Infectious Disease Center, Yaba Mainland Hospital. This brings to 8 the total number of discharged patients from the center. The patients who had been quarantined at the isolation center for weeks look stable and unruffled. Although the discharged patients preferred anonymity, they expressed joy and satisfaction over the treatment they received. While thanking the state governor Babajide Sanwo-Olu for his support and proactiveness, they pleaded that the workers at the center should be given life insurance. One of the discharged patients gave an impressive hope, saying people should not panic as the virus could be defeated. Meanwhile, the Lagos State Governor Babajide Sanwo-Olu had asked residents of the state not to panic following President Muhammadu Buhari's order restricting movement in the state. The governor said the restriction on the movement is a tough decision, but a necessary step in the battle for survival against the COVID-19 pandemic. He disclosed this in a statement where he said despite the rising number of cases in the state, there was no cause for alarm. He maintained that the restriction will enhance chances of defeating the coronavirus by giving room for medical workers to deal with cases faster, contain the disease as those infected will be easily identified and isolated, and thus enhancing social distancing, while the restriction will prevent more people from contracting the disease. He saluted the Lagos State residents for their patience since measures to fight the coronavirus were announced, and added that Lagos State government, in partnership with the Federal Ministry of Health, the Nigerian Center for Disease Control, the World Health Organization, among other institutions, will stop at nothing to halt its spread. Governor Sanwo-Olu advised that those in the private sector, market leaders and traders are to move out inflammable materials such as petrol, kerosene and others from their offices and shops before the restriction begins at 11 p.m. He urged them to also switch off all electrical and electronic appliances to stave fire incidents during the 14-day restriction. Nigerian senators have agreed to contribute 50% of their salaries to the efforts to curb the spread and treatment of coronavirus in the country. The Senate Committee Vice Chairman on Media and Publicity, Senator Godiya Akwashiki, revealed this in a statement. The statement said the contribution, which would be monthly, will be sustained until Nigeria is declared free from the ravages of this deadly disease. According to the lawmaker, the Senate is willing and ready to do what is required of the legislature for the effectiveness of the measures presently in place, or that may be required in the future to win the fight against COVID-19. The statement commended all agencies of the federal and state government for working in collaboration to protect public health across the country. As part of efforts, the Rivers State government laid down measures to prevent the spread of COVID-19 in the state. The federal